I'm Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Very often for infertility, the first line of treatment begins with giving letrozole or clomiphene citrate tablets for ovulation induction, which means that the egg is helped in this ovulatory process by giving these medications. Today we'll talk about why letrozole is given and what is the role it plays in ovulation. Now, before we understand about letrozole, let's talk about a protein called aromatase. Now, this aromatase is very important for release of a hormone called estrogen. In PCOS patients who already have very high estrogen, which is why the egg does not grow, the egg does not ovulate, the estrogen levels are very high, because of which the egg does not ovulate at the right time. What letrozole does it blocks the release of aromatase protein, due to which the level of estrogen comes down in the body, and because of this the reduced amount of estrogen in your body will then give a signal to the hypothalamus pituitary to release the important signals which are important for the growth of eggs, which are follicle stimulating hormone, later on luteinizing hormone, etc. So the machinery begins again. Letrozole works very well for patients who have polycystic ovarian syndrome. Clomiphene citrate on the other hand works very well usually for patients who have low ovarian reserve, who do not have a problem with estrogen levels. They already have very low estrogen levels and for which clomiphene citrate is given. But when we talk about letrozole, it works very well for people who are having ovulatory disorders. It could be anovulation or it could be prolonged duration for ovulation, etc. It is usually given on the period day 3 to day 7, which is to say around 5 days, or from day 5 to day 9. So it's usually given for 5 days, once every day, and a scan is done after these 5 days to see if the dose is working, if the egg is growing, and then depending on whether you're trying naturally with intercourse or with a procedure called intrauterine insemination, the procedure is taken forward, and if there is resistance from the ovary in ovulation, HCG, human chorionic gonadotrophin, which mimics luteinizing hormone, is injected. That helps in ovulation of the egg. That way, having intercourse around that time or performing intrauterine insemination by doing the procedure in the laboratory, your chance of success increases. So letrozole works very well for such patients. To understand more or to help get pregnant with this procedure, with these treatment options, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.